Good afternoon, everyone. The NCBA Health and Wellness Program welcomes you to our webinar today as we observe Older Americans Month. This webinar speaks to diet and physical activity for cancer prevention. Our presenters today are both with the American Cancer Society. Maddie Troy is a Senior Development Manager with the American Cancer Society, a University of Maryland graduate. Maddie focuses her efforts on the DC Making Strides Against Breast Cancer event and the American Cancer Society's larger efforts in the fight against breast cancer. Maddie has worked in the nonprofit field since 2016 and has a passion for ensuring that every person has access to quality healthcare. And next is Vivian Stearns-Elliott. Vivian Stearns-Elliott is Director of Regional Marketing and Communications with the American Cancer Society for almost 10 years. Prior to that, her background was in hospital communications, TV news producing, and freelance writing. She graduated from New York University with a Bachelor of Arts in Journalism. Thank you and welcome, Maddie and Vivian. Thank you.
Hi.
Hi, thank you, Angela, for that introduction. We're really excited to be here to talk about this really important topic and shine some light and answer any questions that you all have. So my name is Maddie. I'm here with Vivian as well. And wanted to kind of just start this presentation and see if you can put in the chat if you feel comfortable, if you or anyone in your family or your friends has a connection to cancer. So you can say what it is, you can, put yes, or if you don't feel comfortable, that's okay. But I kind of just wanted to get a read of who all is here with us today. And while you do that, I'm going to start sharing my screen and going over our presentation. All right, so diet and physical activity for cancer prevention. So diet and physical activity, as you'll learn in this presentation, are both really key to preventing cancer. And so while not all cancers can be prevented, diet and physical activity, making sure you have a good diet and you're physically active, are really, really crucial in helping with your prevention of certain cancers. So there's us. Just had a wonderful introduction. All right, so of course, like I said, no diet or lifestyle can really promise full protection against any disease, but following diet and physical activity recommendations can help lower your risk. And so this presentation, we're going to go over what the American Cancer Society has as the most current scientific evidence and kind of give you that information. And these are also consistent with guidelines from the American Heart Association and the American Diabetes Association, both for the prevention of coronary heart disease and diabetes and just general health promotion. So to start, why worry about diet and physical activity? I really like this infographic because it kind of puts it into like a picture form. 1 in 5 cancer cases are linked to things such as body fatness, poor nutrition, physical inactivity, and excess alcohol consumption. So that's about 20%, which is a huge amount, especially when you're thinking about how many people are diagnosed in the United States every year. In fact, diet and physical activity are really second only to tobacco as a cause of cancer. So that's just why it's so important that actions such as avoiding exposure to tobacco, getting to and staying at a healthy weight, staying physically active throughout your life, eating a healthy diet, and avoiding alcohol intake can really reduce your lifetime risk of developing cancer. So while some cancers are linked to physical fitness and diet, not all of them are, but a lot of these behaviors are also linked with a lower risk of developing cardiovascular disease and diabetes. So really, this is just great for your health in general and reducing all types of different diseases. So move on to the next slide. I'm going to check. I think we got something in the chat. So sorry if I don't know if you can see this over here. Let me, there we go. Okay, going back. All right, technology challenges. I apologize for that. All right, so why worry about diet and physical activity? This is just a little more. What we eat and how we live affects our risk for cancer. Oh, sorry, I'm trying to get rid of this. I don't know if you can all see that. So like I said, 1 in 5 cancers are linked, and about 16% of cancer deaths are related to these same factors. So that means that about 16 of the percentage of those diagnosed who have links to excess body weight, lack of physical activity, drinking alcohol, and or poor diet eventually result in death. Some good news is some of these cancers can be prevented. And so that's what we're really here to talk about today, is how we can all lower our risk of getting cancer throughout our lifetime. So let's start. The ACS recommendations for all individuals basically comes down to these 4 things: getting to and staying at a healthy weight, adopting a physically active lifestyle, and following a healthy eating pattern. And we encourage people to reduce or not drink alcohol. This is kind of a summary of all the recommendations. I'm going to do a deep dive into each of these during this presentation. So hopefully you can answer any questions that you have about each of these. If not, feel free to put your questions in the chat and we will definitely get to them at the end. So while we know that individual actions are really important, we also know that community actions are important as well. And we want to recognize that there's a lot of things at a more regional, state, and national level that do make it hard to make these changes. So we know food deserts are a huge thing. So we want to encourage a lot of what our Cancer Action Network does is increasing access to affordable, healthy foods, providing safe, enjoyable, and accessible opportunities for physical activity, and encouraging things like, just better diet in general. So we understand that a lot of these things are things that happen above just the individual level. So now, as that being said, I'm going to kind of go into what you can actually do as an individual, because we do have things we can do. So nutrition and physical activity. For those who don't use tobacco, the most important things you can do, already went over, control your weight, eat healthy, be physically active, and avoid alcohol. If you do use tobacco, we really suggest the most important thing you can do is quit. It's a proven link between tobacco and lung cancer and other types of cancer. And so while we know it's definitely an addictive substance, we do encourage, there's a lot of resources on our cancer.org website that encourage, that provide resources on how you can quit tobacco. So why is body weight so important? So excess body weight is linked with a lot of increased risk of developing many cancers. Being overweight or obese, these are just a few of the cancers. We know the increase in overweight and obesity noted among Americans is really of a concern among population groups, including children. So children are really establishing lifelong behavioral patterns that affect health. And evidence suggests that obese children are more likely than not to become obese adults. And that is a cycle that is really unfortunate, and that obesity in adulthood for obese children is likely to be more severe. We also know that other groups face more obstacles to engaging in health promoting behaviors. So lower income individuals, racial and ethnic minority groups, people with disabilities, those residing in rural communities. We know it's more difficult to access those healthy and affordable, high quality foods. And if you have limited access to that food, it's difficult to, stay at a healthy body weight. So yeah, let's admit it is very tough to lose weight. So we encourage you to start by eating so that you don't gain weight. So we encourage you to eat as many fruits and vegetables that you can, because those give you nutrition and that helps you fill you up with fewer calories. If you are overweight or obese, it's really important to talk with your healthcare provider about your eating and physical activity plan, and see if they have a recommendation for a group support as you work towards your goal. So finding your healthy weight, BMI is one thing that can help you find what your healthy weight is. I want to preface this slide by saying BMI is not the final word in whether or not a person is overweight or obese. We know that there have been, conflicting views on how BMI is used. For example, someone with bigger muscles might have a higher BMI, but they might not be obese. And so just use this with a grain of salt, but it is a good starting point or reference point if you are unsure where to start. And it's basically a number based on your height and weight. In general, the higher the number, the more body fat a person has. So there is a calculator, and you can probably, I think, find it on cancer.org, or if you just Google it, but those numbers are the ranges that are considered in the BMI scale. All right, so now kind of moving on to adopting a physically active lifestyle. The biggest message we have here is just to move more and sit less. So adults should get at least 150 to 300 minutes of moderate intensity or 75 to 150 minutes of vigorous intensity activity each week. So what qualifies as physical activity? Really anything from you working around the house to brisk walking to triathlons. So what you choose to do really depends on your level of fitness. And people with medical conditions should obviously talk with their doctor first. You don't want to go beyond your usual daily physical activity of working, and you want to kind of maintain what your body is comfortable with. But it's really important that you do get that activity. So a moderate activity could be a brisk walk. And then a vigorous activity would be when you start to walk faster, you're starting to breathe faster, get your heart rate up, and you're starting to sweat a little. So that's kind of the difference between the two. So if you have any questions, so I guess I'll give a couple examples. So moderate intensity activities, could be walking, leisurely bicycling around your neighborhood, mowing the lawn, kind of general housework, vacuuming, that kind of thing. And if you do any walking or lifting just as part of your job. Then going into the vigorous intensity, this would be kind of fast walking or jogging, fast bicycling, weight training, doing any aerobics where you're jumping, any of that kind of thing. And if your job does involve any, carpentry or heavy manual labor, that would be vigorous intensity. So did I just skip a slide? Yeah. So there is growing evidence that the amount of time we spend sitting is important, and limiting that time is really important because we do spend a lot of time sitting, and especially because of COVID, we're at home a lot, and that really does affect our bodies. So the point of this is just think about when you are sitting down, kind of, could you be standing? Could you be walking around at that time? This isn't something you do for 1 week. We really want to encourage you to become active for the rest of your lives and really integrate this into your healthy lifestyle. So really health benefits for this, doing more physical activity than you usually do, no matter what activity level you're at, can really have a lot of health benefits. So a couple of tips to reduce that sitting time. I know I sit a lot. I have a standing desk, but I don't use it as much as I should. So really tips to reduce your standing time. You can park maybe a little farther from where you're going and walk to your destination. That's one I like to use. During when you're watching TV, you have a stationary bike or a treadmill, you can be on that. Lots of these things. Some of these activities we know are really hard to do in a pandemic such as COVID. So that does limit sometimes your mobility, how, you can't really just go out and talk with friends if, the pandemic is currently going on. So just use your good judgment, stay safe, follow the public health recommendations. But there are kind of the things I talked about that are things you can do alone or with one or two friends or family members. All right, so now I'm going to kind of get into more of our diet part of the presentation and how you can follow a healthy eating pattern. So really your diet should include a lot of high nutrient foods in amounts that help you get to and stay at a healthy body weight. So a lot of our recommendation is to really base your meals on plant foods. So foods that are colorful, whole fruits, whole grains, legumes, things that are healthy protein sources. So like fish and poultry, and lower in processed meat and red meat. Unsaturated fats are good. These patterns we also encourage things that are lower in added sugar, lower in saturated and or trans fats, and limiting excess calories. So those red and processed meats, we encourage you to eat fewer of those. I know it's hard, and I know especially sometimes the grocery stores we shop at don't have as many healthy options for us. But we do know that healthy eating patterns are linked with a lower risk of cancer and certain other diseases and dying at a young age. Eating a variety of vegetables and fruits. So we just say eat as many colors as you can. So if you see those pictures, if you have a rainbow on your plate, that's perfect. So including vegetables that are dark green, red, and orange, those are the most vitamin rich and complex. They have the minerals, the vitamins, the fiber that you need to not just be healthy, but to prevent cancer. Vegetables and fruits lower cancer risk, also because they're helping you maintain a better body weight. So legumes, you can see pictured there, are also really good to add to your diet. Things like lima beans, lentils, and soy are rich in protein, fiber, iron, zinc, potassium, and folate. So those are all really great ways to increase things like your protein, replacing those with things that you might have used to eat, like red meats. They can, provide that protein that those red meats might have offered you originally. So get at least 50% of your grains as whole grains. So whole grain foods such as whole grain breads, pastas, and cereals, we should really encourage you to eat those instead of just regularly processed breads and grains. Whole grain foods are made from the entire grain seed, so they're lower in calories. Then they're also processed less than any refined grains. They're high in fiber, they're high in certain vitamins and minerals, and they're linked to a lower risk of weight gain and being overweight. Whole grains include things like brown rice, 100% whole grain bread or pasta, regular oatmeal, quinoa, and lots of other grains. If it says whole grain, it usually means it's better for you. We're encouraging you to eat less food that is made with white flour. And we really just say, read the labels. So for instance, people may not know that wheat bread is not the same as 100% whole wheat. Even if the bread looks brown, they might not be using that whole grain that we encourage. So limiting your intake of red and processed meat. So red meat includes things like beef, veal, pork, lamb, goat, also processed meat like bacon, sausage, ham, bologna, hot dogs, deli meats. All of those processed meats have been linked to increased risk of cancer. And we really just encourage you to limit the intake. So using meat as a side dish is a really great option, or a flavor enhancer rather than the focus of your meal. There's a ton of other protein sources. Like I talked about, legumes are great. Beans are really such a healthy source of protein that you can incorporate into your diet. And then fish and poultry in place of red and processed meat are also a really great option. So following a healthy eating plan really can help you get to your healthy weight. It can decrease your exposure to cancer-causing compounds. And that's really what I'd love for you to take away from this. It's if you can try, one or two of these techniques, it really will make a difference. Studies have also shown that healthy eating patterns are, as long as you have a few of them, you don't have to cut out all red meat. You don't have to cut out all processed foods, but really just eating smaller portions of those high calorie food, choosing vegetables and low calorie foods when you can, choosing those whole fruits and whole grains when you can. And then when you're eating away from home, eating out at a restaurant, just be more aware of the foods that you are eating. If they have, a lot of calories or fat or added sugar, just be aware of it and think about it as you are making your decisions. The American Cancer Society has a really great book, and it's called What to Eat During Cancer Treatment. And I'll put the link in at the end of this and send it out to Angela as well, so she can send it to you. But for those of you who may be going through cancer treatments or know someone who is, it provides a lot of recipes that are good for your body and that are going to help with whatever kind of treatment you are going through, because that is, it's so important to give your body what it needs when it's healing. So that I think is a really great resource, and it's great too if you're not going through a cancer treatment, because it's still is really effective. All right, so moving on, we're going to talk about alcohol right now. So our guidance is really that it is best not to drink alcohol, because there unfortunately is a proven link between drinking and any amount of alcohol and your risk of cancer. So if you do choose to drink alcohol, ACS recommends that women have no more than one and men have no more than 2 alcoholic drinks on any given day. And you can see what that one drink of alcohol is below. And these daily limits don't mean that you can drink larger amounts on one day of the weekend and not drink the rest of the week. This too can lead to other health problems. But this is our guidance. We know this is, again, is difficult for people, but just know that there is unfortunately a risk of drinking alcohol and your increased risk of cancer. All right, so now I'm just kind of going to get into a little bit about what we recommend for our community partners. So we know that there are a lot of social, economic, and cultural factors that affect your choices about diet and physical activity. And we know that you would like to sometimes adopt a healthy lifestyle, but find it hard when there are a lot of diet and activity guidelines. So like I said before, there are a lot of things that we've identified as getting in the way of eating a healthy diet and being physically active. Those food deserts are probably one of the biggest ones. We know lower income neighborhoods often don't have access to supermarkets that sell affordable and healthy foods. The increase in overweight and obese children, we know, is a concern because those children don't have access to any sort of healthy food sometimes, and they do have access to a lot of marketing and a lot of high calorie foods and drinks of low nutritional value that are going to affect their overall health. So just kind of wanted to highlight that we know we need a lot of collaboration between public, private, and community organizations and work at the national level to decrease these barriers to healthy life choices. And that includes access to those affordable, nutritious foods and decreasing access to and marketing of foods and drinks of low nutritional value. Another big thing we're trying to work on is providing safe, enjoyable, and accessible environments for physical activity in schools and workplaces. So, providing opportunities for kids to get outside and play and be active and set those children up for a healthy lifestyle in the long run. When it comes to alcohol, limiting the number of alcohol sellers in an area is really important. Limiting days and hours for alcohol sales, enhancing laws that are preventing sales of alcohol to minors. These are just some of the things our Cancer Action Network is doing, among many others in the lobbying and government space. All right, so I'm going to kind of just recap everything we talked about. So, as you know, for individuals, getting to and staying at a healthy weight is so important. Adopting a physically active lifestyle, following a healthy eating pattern, and limiting the amount you drink. So you can kind of see here, I included this little infographic. I thought this put it into a really great picture. So you can see this plate. This should be your plate when you're eating. 50% is whole fruits and vegetables. And then you have a small amount of whole grains and a serving of lean protein. These are kind of like the portion sizes. So that 50% that's whole fruits, and then the 25% for each of those whole grains and lean proteins. And then there's a little clock with the people running 150 minutes of moderate intensity activity, and then 75 minutes of vigorous intensity. You can do either one of those. You can mix it up, combination of the two throughout the week. Just getting outside or inside, walking around your house, doing housework, just, increasing the calories that you are burning. And so that is all I have for our presentation right now. I do want to point out that the American Cancer Society has a cancer helpline, and it's 1-800-227-2345. And this helpline is available 24/7. Every single time you call, you will reach a live person who can talk to you about anything. They're, trained in a number of different subjects. There are cancer information specialists. So if you do need help, please feel free to call that number. We also have a cancer.org website that has all up-to-date information as resources. It's really a great place to go if you don't know where to start. So I would really encourage you to check that out. It has all the information I shared today and more. I'm gonna now turn it over to Vivian. Let's check if there's any questions. All right. No questions yet. So if you all have a question that you'd like us to answer, please put it in the chat. If not, I think if you don't know if Angie, you want to jump in with anything?
I do, and I want to thank you for such a thoughtful presentation. I've got some work to do to make my plate a little greener, so I thank you for stressing the need to do so. And as Maddie mentioned, if you have any questions, please include them in the chat. And to kick us off, I'm going to ask a few questions if that's okay.
Yeah.
Thank you. My first question is, does the ACS have a nutritionist on staff that can provide in-person or telephone guidance on how to eat better?
I can take that. We do have nutritionists on staff. However, the best thing is to call that 1-800 number. And if you do need guidance on nutrition, ask what the availability of a nutritionist is. I have to say, I don't think that we'll be able to set people up with a one-on-one, but we will certainly help them navigate resources in their area so they can find a nutritionist. And we do have a nutritionist who's on staff who does all this advising, who helps us with recipes, the diet recommendations that Maddie just went over, and etc. So call the 800 number. That's the best thing, the best starting point. It's 800-227-2345.
Okay, and we'll put that in the chat. And just to firm that up, I don't have to have cancer in order to speak with a nutritionist. Is that correct?
Oh, absolutely. And the 24/7 line is for the community. You don't have to have cancer to call the line. You can be a caregiver. You can just be somebody who's interested and wants to learn more about cancer prevention or wants to learn what the latest things the American Cancer Society is doing. It's your go-to line for any kind of cancer information.
Oh, thank you. That is wonderful. And then just to piggyback a little bit, I'm particularly interested in that green plate that Maddie spoke to. But I also wrote a note to myself that food prices are astronomical. And I wanted to know if when speaking with that nutritionist, if that person would be able to connect me with some grocery markets or farmers markets where I could purchase healthy foods at a discounted or nominal price.
Well, that's a great question. But again, I don't mean to be repetitive. We're going to have to refer you to the 800 number. You can also call your local American Cancer Society office, get more involved and see if they have recommendations. But to get that to that local office, again, you go to the 800 number. And it's a great point that you have, that people can look for farmers markets. They can look at food pantries. We can certainly, I think if you call the 800 number, guide you to things that are less expensive. There are things that are higher proteins like beans and legumes and things of that nature that are not as expensive as meats and fish, because those do tend to be more expensive items. So I think that people, who are budget conscious can pick really healthy foods. They just have to learn how to budget and look for the best prices and bargains.
Okay, and thank you for that. And then this one is my personal question, since I always lie to myself about my BMI. And
We all do.
thank you. And when calculating our BMI, is that something that our doctor can help us with, or is that okay? And is that something that we should request annually, or how might we go about getting some real accurate measurements there?
Do you want me to take that too? Well, as Maddie said, there are charts online for your BMI, but your BMI is a guide.
Okay.
For example, I have a husband and a son who are big boned muscle guys. I don't think that the BMI quite works for them, or at least so you need to talk to your doctor and take everything in proportion, but it is a good general guide. And the other thing that I wanted to emphasize about this diet and exercise that Maddie has presented is that this is a way to empower people to reduce their cancer risk. I wanted to say that unfortunately research, and we do a lot of research on health equity, has shown that there are certain minority and ethnic groups, and unfortunately primarily in the Black population, where cancer risk, for reasons that we know and don't know, are higher. Recovery rates are lower. I don't mean to spread negative news, but I think that's part of being empowered, is to understand what your cancer risk is, that it is higher in the Black population. This can be genetic, this can be environmental, it can be cultural due to diet, exercise, traditions. We are doing a lot of research to uncover what the bottom line is, what these indicators really are. But the good news is that you can empower yourself. You can change your diet. It's never too late. You can change the amount of exercise you get. You can try to make more conscious efforts if you are in a food desert, if you do have challenges to buying those healthy foods. Yeah, do call our 800 number and ask for advice and ask for guidance. Those are things that you can do to change your cancer risk. And then early screening. The earlier cancer is diagnosed, the more treatable it is. It's even preventable. And I think that a lot of people in the community, thanks to our communications, know that if you get screened for colorectal cancer, you can sometimes catch it before it even turns into the cancer, that there are early conditions, polyps that develop and other changes in the colon that can be caught before they become cancerous. And this also exists for some other cancers too. So it's so important to talk to your doctor, go to your local center. There are a lot of health centers that they're federally qualified health centers. We have a list of them. If you have insurance problems, if you have insurance challenges, we will help you find the place to get screened. And the place to go to on our website is cancer.org/get-screened. It has all the screening recommendations. It will help you guide you to where you can get screened. So I think diet, exercise, as Maddie has talked about, and being vigilant and getting screened early, go find help if you think you have symptoms. All those things can help reduce your cancer risk and give you a better chance for a healthy recovery if you are diagnosed.
Thank you, Vivian, and thank you very much for your candor and honesty. We know that cancer is the prevalence of cancer in Black and Brown communities is there. And so this conversation is so important. So I appreciate your candor. And I also want to circle back and thank Maddie for saying that sometimes diet and exercise may not necessarily prevent cancer. I know I have an aunt who is very fit, was very fit and consumed a very nutritious diet throughout her life, but she also too was a smoker. And eventually she had, was diagnosed with cancer. So I appreciate you making those comments early on in your presentation. Really important. And then I want to speak to something you said, Vivian, about screenings. I know with the pandemic, or at least prior to the pandemic, there were vans that you'd see in the community where you could go in and get different types of screenings. And I'm speaking to mammograms and so forth. Do those vans exist now that we are somewhere in our fourth wave of a pandemic? Is that possible?
Well, many times those vans are part of a mission by a local hospital or a health center to go out into the community, and especially to go into communities that may have a lower rate of screening due maybe to transportation challenges or location of being really close to a health center. So those are very individual. And you have to look up in your community, do a search online to see who's offering that. I do think you're right that during the pandemic, that kind of came to a halt for health reasons. They weren't bringing vans out into the community. And overall screening was hurt by the pandemic, whether it's going to your doctor's office or, going into a center. But as far as we know, all these centers have now reopened. For a while, there was a backlog because people were returning to screening, and it took a while for those people to cycle through. But unfortunately, even before the pandemic, screening rates were not where they should have been. So we have really put a lot of resources right now into a Get Screened campaign. You'll see messages. They might be on billboards in your community.
Sure.
They might be online. They might be at your local hospitals. They might be on the airwaves, on buses. Because we are a grassroots nonprofit organization, we do not have the marketing dollars to put in that a commercial business put into their products. And so we really appreciate, like you, the caucus, helping us spread these messages verbally and one-on-one. So thank you for this opportunity. It's really wonderful.
It's our pleasure. It's our pleasure. You're welcome to join us anytime. Looks like we have a question that came up in the chat here. So it reads, most cancers do have screening to determine risk ahead of time. Pancreatic cancer is often diagnosed in the later stage. Is there a screening for that?
To my knowledge, there is not a screening for that. You can go on, again, cancer.org/screening to find out what screening recommendations are. There's for breast cancer, prostate cancer, lung cancer is making great headway with screenings. If you have a smoking history or anybody in your family does, look up what the screening guidelines are now for lung cancer. We are really trying to take the stigma out of smoking. I mean, smoking is an addictive thing. There is no blame to be put on people for, becoming smokers. What we want to do is give people the best opportunity to beat lung cancer. And so there are CT scans that now can be done for lung cancer. Pancreatic cancer, I believe, is something that you just have to be really vigilant about symptoms, stay in touch with your doctor, go to have your annual checkup. If you notice any changes, I don't want to misspeak what the symptoms are for pancreatic cancer because I don't know them right off the top of my head. I think that probably abdominal pain may be one of them. But if you have things, know your body. If your body's changing, if there's suspicious things happening that you feel uncomfortable about, don't hesitate. Get in touch with your primary care physician. If you don't have a primary care physician, find out if there's a federally qualified health center in your area or a clinic of any kind that you can access. And call our 800 number. Say you don't have a doctor, you need help finding a physician and a screening.
Okay, thank you for that. And we will put that in the chat also.
Okay.
And just a little naughty question here. In terms of smoking, does the ACS have the same guidance for vaping and marijuana cannabis use? Or is smoking just smoking across the board? No smoking.
Well, it's all tobacco products, and vaping is included. Vaping, even though there is vaping that says that they don't have tobacco products in the vaping solution or whatever it may be called, there are many chemicals in there that have not been investigated properly and have not been FDA regulated. So right now, our philosophy toward vaping is the same as our philosophy for any kind of tobacco product.
Okay, thank you. Thank you very much for that. And then I've got all the questions here. So I'm going to invite our audience to join me and ask some questions here so that I don't take up too much time with my questions. My question is, how do I get my church involved?
Well, we are very involved with churches. The best thing is, again, I'm going to keep telling you, go back to our 800 number.
I love that 1-800
because
number.
our 800 number will put you in touch with your local office. And then your local office may be able to tell you already whether we have health ambassadors within your church community. We do have programs that train health ambassadors. One of the kind of synergies that may intersect with people who are connected with your caucus is the Links, which is a really famous organization of Black women. It's across the country. I think it's one of the oldest volunteer organizations in the country of any kind. And they have been training their members to be health ambassadors and to go into churches to help spread the word. And go to cancer.org, just type in my church, and see what comes up. We have a lot of information, but go to that 800 number. That's what they're there for.
Okay, we're going to go to that 1-800
Okay,
number.
thank you.
Okay. And just to piggyback on something you said that is of interest, is there a certification that comes with becoming a health ambassador?
Yeah, I do think so. I don't have the nuances of the training, but there is something that you go through and you can become a health ambassador for your church.
Oh, isn't that?
And that basically is going to mean that you're going to be very knowledgeable in screenings and encouraging people to take care of their health. Maybe you might do a presentation like Maddie just did.
Oh, that's wonderful.
Yeah, there are different nuances to it, but that is a great way to reach the Black community. The African American community, as we know, is a community that's very devoted in many instances to their church life. So and the church life helps imbue not just spiritual health, but physical health as well.
Yes, thank you very much for that. And then my next question is something that we didn't cover, sleep. There's a lot of dialogue about the importance of sleep. If I call that 1-800 number, will so
I'm gonna let Maddie answer some of these questions, so I don't sound like a parrot that's repeating
No,
myself.
not at all.
Okay.
Is there someone on staff who can talk with me or any of us about the importance of sleep and how many hours? There's so many mixed messages about the number of hours midlife adults need on sleep. So any guidance that you might share with us on the importance of sleep?
That's a great question. I mean, sleep is definitely important. I don't want to misspeak because I don't know if there have been any specific studies on sleep and cancer prevention, but sleep is important to a healthy lifestyle. And, that then leads to when you're sleep deprived, you're not going to exercise as much, you're not going to eat as healthy. But I don't know if there are any specific studies, so I don't want to misspeak, but there are a lot. I believe we have resources on cancer.org on how you can get better sleep and more effective sleep.
Yeah, we do, Maddie. I'm looking them up right now.
Okay.
And there's a tremendous amount about sleep.
Okay.
And actually, we have a program for our staff at the American Cancer Society to help us stay healthy. It's a health portal in which we record a lot of our habits. And one of the ones they ask us about that we get credit for is getting good sleep, getting enough sleep. And there's such a thing as sleep hygiene, which is tips for how you can help your body go to sleep and get the right amount of sleep if you're having sleep issues. So all you have to do is go to cancer.org and type in sleep.
Right, thank
We're
you.
like an encyclopedia.
Oh, I love that. And thank you very much, because I know sleep is sleep, eating well, exercise, and your stress level all factor into your a healthy weight. And so I wanted to know if there was guidance. And that does lead me to my follow-up question about mental health in this conversation. I bet if I visit cancer.org, I will find some resources maybe that speak to the importance of managing one's stress so that you can have a healthy body weight.
Well, certainly all those things are interconnected, and you're asking, a kind of answering your own question.
Yes.
That is a complex interwoven issue. What I wanted to say is that for the cancer person going through the cancer journey and the caregiver, there is a lot of anxiety and stress involved. And we certainly do have tips on managing that. And one of the things that I've also heard, I've heard cancer patients say this, that they were reassured, and caregivers, that in the middle of the night when they couldn't sleep, when they're worried about their diagnosis or can't remember exactly what their doctor just told them or what the next step is, or they've already feel like they're exhausting their friends and their relatives with just talking about their stress level, you can call that 800 number in the middle of the night at 2 o'clock in the morning and get someone to talk to and just basically help calm your stress, give you maybe some relaxation exercises. One of the things that I actually have been doing, and this is from our tips, as I said, on our health portal, is the value of just taking 3 deep relaxation breaths and resetting yourself when you get stressed. And that sounds so minimal, but it actually is helpful, and it is one of the tips.
Oh, I love that.
Just to settle yourself, those 3 relaxation deep breaths, just to take your mind off of whatever is, burdening it at the moment. But there's also a lot more: exercise, diet, yoga, meditation. Those are all things that are helpful.
I love that. And thank you very much, Vivian, for sharing that with us. We are back in the office, and Maddie spoke to getting up and walking and so forth. But I think it was just as equally important to hear you speak to just taking 3 deep breaths, even if you're at work or wherever you are in your day. Really important. So thank you very much. Let's see. We have a question here. It says, often when I go to sleep, I wake 4 hours later and I feel rested. Is that normal? And is it true that as you get older, you don't need as much sleep?
Well, we're not sleep experts. I love these questions, but I don't want to, as a layperson, try to, guess at an answer, if you don't mind. It's a great question. I guess, again, go to your doctor, ask about it. If you feel good, I don't know what to say. I wish I only needed 4 hours of sleep.
I know. Thank you very much for that question. Okay. Well, it looks like we don't have any additional questions in the chat. I'd like to extend, if we have any additional questions, then I'm going to keep asking my questions then. Okay. And then one final question that's really important to me about canned food versus fresh food. Does the ACS give any guidance on that?
Did you say canned?
Canned, when, in your presentation, you spoke to whole food, but thinking about consumer cost and so forth, sometimes a canned vegetable or fruit is less expensive.
Yeah, well, I will say I'm not sure if ACS gives any guidance speaking personally, I would say what you can get is the best option. Just like we say, whatever cancer screening you can get is the best cancer screening. The best option of those healthy foods that you can get is the best one for you. So that's what I would say personally. I don't know, Vivian, if you have anything else to add.
Yeah, again, thank you for your wonderful questions, but I'm not a nutritionist.
Okay.
Maybe we can get a nutritionist for you next time.
No,
Actually, a dietitian. I think they're actually called registered dietitians. Yeah.
No, this is great. Thank you. This is really great. And looking through the chat, we don't have any questions here.
Well, Angela, it's been great. I mean, this has been a wonderful opportunity. And if you do have further deep dive topics, maybe Maddie and I can refer you to a different type of expert.
Like that.
Because you do have deep dive questions. They're great questions. And I'm sorry that I can't answer all of them. I know that, nutrition is a fascinating topic, and a dietitian may be able to give you more information.
Well, then we will look forward to speaking with an ACS nutritionist. And thank you both very much for joining us today. Thank our audience, and we'll give you back 8 minutes of your day to get up and get moving.
Well, it was delightful, and we're so honored to be included in this presentation. Wishing everybody really good health. Please, we would love to see the cancer.org visits and the 1-800 number buzz a little more if you really need cancer support, if you're on a cancer journey, if you have a friend with cancer you're worried about, if you want more diet and nutrition and exercise information. We actually have a wealth of that on cancer.org. And get screened. That's so important. And it's never too late. That's the other thing. If you're sitting at home thinking, oh, since we are addressing, quote, older Americans, which I've totally probably fall in that category, it's never too late. Don't say, oh, I've been heavy most of my life, or, all those foods I used to love eating, the soda and the French fries and all that. It's never too late. You can always make an improvement.
I love
Same
that.
with smoking. It's never too late to quit.
We're going to put that in the chat. It's never too late to quit. Thank you very much.
Thank you. Have a good day.
Everyone.
Have a great day. Thank you.
Okay. Bye-bye.
Bye-bye.